Welcome to the Beverly Hills Plastic Surgery Podcast. Today, I am here in Beverly Hills in the studio with my most 4th of July belated co-host, Dr. Millicent Rovelo. You look stars and striped, and it's not the 4th, but it's close.
It's not, but I rarely get things done on time anyway, so it kind of works for me.
Well, you're definitely kicking my ass in the fashion department because these scrubs don't have any stars, no stripes, no nothing.
No bedazzling, no bedangling, nothing. It's okay. I'll dazzle for the two of us.
Thank you. I knew you could pull up the rear on the fashion part of this because I'm just not leading with the strong scrubs look.
I got you.
Today,
Yes.
we are going to do a podcast about post-operative care of the plastic surgery patient. We're going to touch on big points. We're going to touch on things like just the general of what to do after surgery, because all the time, people don't have surgery every day.
No. We do surgery every day.
We do.
And so sometimes we forget that, the average person doesn't live in surgery world every single day. And there's some stuff that they need to know.
They need to know things like chill out. Like you have to turn yourself over to the process. This is a big one.
Yes.
I had a patient just recently who was so nervous before surgery. She was freaking out. She was yelling at my staff. She was just having the worst time ever. Nobody told me what time this case is going to start. I don't know where to get my medications. I don't know who's going to be doing the anesthesia. I don't know. Just losing it. And we were like, well, we were going to give you all that information in the packet we gave you already 3 weeks ago. And it's all there and everything's there. And I said, let's walk through it. Evidently we just need to turn the pages for her a little bit. So understanding that there is information available, that we do give you that information.
Oh, yes.
It does require reading, questions, phone calls, and you do have to be an active participant in your post-operative care. It's really important.
It's super important. So the whole purpose of this podcast, I feel like we're doing a lot of alliteration today. Post-op plastic surgery podcast pitfalls.
And pearls.
And pearls. And perils.
And evidently people don't know what pearls are when it comes to knowledge, but we call them pearls of knowledge.
Pearls of
That's like, oh, that's a nice little pearl. That's a good little that's a good tidbit of information.
To have.
So this is pearls, pitfalls, perils
of plastic surgery.
Post-operative care podcast.
Yes, exactly. All of the above. And so we're going to talk a little bit on just general things to do after really any surgery, not even necessarily plastic surgery. And then we're going to break it down into various areas of specific plastic surgery. So the face, the breast, the body. Now, we have all of these podcasts out there in their full form. We have post-op tummy tuck instructions. You have post-op rhinoplasty instructions. They are out there. You just have to scroll through them or search within the podcast itself to find them. So if you feel like you need even more information than what we're doing in this more condensed version, feel free to look those up because they are definitely out there. And I have had multiple patients tell me that after they listened to those podcasts, they didn't have any more questions. And then after surgery, they go back and listen to them again. And then okay, I don't need to bother you with any more questions. I got it answered. Yeah,
the post-op instructions for rhinoplasty patients, I pretty much send that to all my patients because I'm just like, you need to listen to this podcast. Now, whether they do or not does make the difference between the number of phone calls I get versus them being relaxed and understanding or them really struggling with the post-operative care.
Right. And the other thing, and I can't speak for every plastic surgery practice, but I would have to imagine that most of them operate in a similar way. You will get a ton of information before surgery. We email it, we put it in a folder at the time of your pre-op appointment. All patients have an appointment before surgery to go over the plan. That's when they sign their consent and do all of that paperwork. All of that information is in the packet that you get or the emails that you get. Read it. Read it before surgery.
Wait. You think I should read it?
You should
Dr.
read
Rovelo?
it. Yes.
Or should I just use it as like a coaster on the kitchen table?
Please read it. I know you're thinking that, it's for post-operative care. I don't need to read that until after surgery. But so many things in there, in that list of instructions you get, are helpful to prepare for ahead of time. I had one patient tell me specifically, she's like, you really should tell your patients to get X, Y, and Z before surgery because after surgery, I was on drugs and I ordered all the wrong stuff off of Amazon. She's like, I thought I was getting a single bottle and I got 50 individual bottles. She was like, I was on drugs. My mind wasn't working right. So the day after surgery is not the time to start reading your post-op instructions.
No, and you want to be ready. Like this is part of the deal. So that's a really important point. My wife, who is in nursing school and going to be doing nursing in the practice very shortly, it's a kind of a pandemic thing she did, just made the point to us as we were preparing for this podcast that whatever your major factor of your personality is, if you're a happy-go-lucky person with lots of energy, if you're a depressive person, if you're always angry, if you're whatever you are, that personality trait will be amplified in the post-operative period because you disinhibit all the other things that sort of weed into your controls of your personality and how you present every day in life, and whatever your personality is in general is amplified in the post-operative period.
Like to the nth degree. I always think alcohol is a truth serum. Like the person you are when you're drunk is sort of who you actually are. Are you angry? Are you sad? Are you miserable? Are you happy? Do you laugh? Like all those drunk personalities that come out.
I don't know what you're talking about.
Okay. I get really happy and giggly. That is, and I dance. Those are the people, that's kind of your basic, your inhibitions are gone. Anesthesia does that to like 1,000%. So it is not uncommon to have the person that had a little bit of anxiety beforehand that was kind of controlled, all of a sudden just lose it afterwards.
Totally.
Or yes, that person that kind of has that angry undertone, gets angry with the nurses afterwards and has issues. Or you have that person that's just a joy to be around preoperatively. They're kind of a joy to be around after surgery. But that being said, if you know that I think especially the anxiety patients, if you know that you're prone to being an anxious person, preparation is really helpful for that.
Load up the Xanax.
And take your meds. If you've been given some anti-anxiety meds, then there's a reason. Like you should take them. It helps a lot. So kind of just know yourself and know what you're prone to, and just prepare yourself and have everything prepared so that you can go into your post-operative period just ready to conquer it. Because we do the hard part during surgery, but then the post-operative time period, that's on the patient, and that can be equally hard. So you want to be prepared.
Yeah, and you want to heal right. So like there's a protocol really of how to be a good patient in the post-operative care. I'm going to say, and some people I know do some things that I would say aren't good, like don't do surgery 2 days after.
Please, people, just don't do it.
Do as we say, not as we do. So there are certain things that come up, and I'm just like, no, that's not a good idea. And the doctors are the worst.
We are the worst. And
they're the worst patients.
So yes, do as I say, not as I do.
I had a doctor just now.
Yeah.
On post-op day 4, thought, I just needed to see my nose, so I took the splint off. Is there a worse day to take the splint off than post-op day 4? I'm not sure.
That's awful.
I just needed to see it. I really wanted to see what happened. Like, and of course, the response is, it's so swollen.
Of course. Yeah, now you just made it more swollen. Thanks.
It's
awesome.
okay.
Hopefully
I'll still take care of you doctors. I know I take care of many, many, many of you. But, God, just for once, don't be a doctor.
Yeah, and here's the thing.
Turn yourself over to the process.
Like, if your doctor or surgeon is telling you something, it's not because they want to hear themselves talk. No. They are telling you to do something for a very specific reason. And even if you don't understand what that reason could possibly be, please just do it because they have a reason. They're not just making things up. I get very paranoid about my implant patients and anybody that has drains, and I don't want infections. I don't want complications.
Yep.
So I am very strict about the things that I tell my patients. I want you to do this, don't do that. And I'm telling it to you for your own good because I don't want you to have a problem. So please just listen to me. That's all I ask. Just do what I say, please.
Just listen. So specific to, let's talk about breast recovery. So breast implants and reductions are 2 separate operations. And I think, though, that for the most part, you're going to be in a surgical bra after surgery and maybe some padding in there with it, depending on what operation you had. You're going to have steri strips or something over the incisions. And this is not the time to vacuum the house in the post-operative period, which has been done.
Oh, yes.
I have a hematoma in my days at UCI because, I was home. I was kind of bored. I felt pretty good, so I figured I'd vacuum the house on post-op day 3.
No.
Hematoma.
Yes.
So back to the operating room, drain the hematoma, et cetera, et cetera. So no rearranging the furniture, Don't vacuum. Take it easy.
I don't even let people do housework. I say no cooking, no cleaning, no laundry, no, bending over, no nothing.
Hold still.
Hold still, because up to about 3 weeks, you can get little bleeders in the breast that just, pop off with too much exertion. They're quiet, they're not bleeding, and then you bend over, you pull something, or you do something that's too strong, and that little clot that was holding the blood vessel closed all of a sudden busts open, and now you have a big giant breast, and it's a big problem. And it's hard because, for the most part, most breast surgeries aren't super painful. So by a week, you're feeling okay and you think that you can do more. Just don't. For at least the first 3 weeks, just be a princess, sit at home, don't do anything, let others do it for you. And that's where you're really going to get your best results. If you have drains, this is where I become really, really strict. If you have drains, it's because I've put in breast implants or I've done something really complex to your breasts. If you have implants in place, those are foreign bodies. They can get infected very easily. A drain is a two-way street. It lets fluid out, but it can also let fluid and bacteria right back up into that space next to the breast implant. Everyone has different protocols with drains. My preference is to not shower. I don't want those drain bulbs getting red and stinky and collecting bacteria and mold. So sponge baths, etc. only. I don't want you leaving the house with drains. You don't need to interact with the outside world that's full of dirty, disgusting, gross grime and bacteria. I don't want your pets or small children crawling all over you and getting their little sticky hands all over your drains. Think of yourself as living in a bubble. Until those drains are out, I don't want you contacting the outside world. I don't want you going for walks around the block. I don't want you deciding this is the time to go for that hike you always want to go to. Just keep your butt at home for a couple of weeks, please.
It's really important, and it's hard to understand. But there bad things happen with activity. They do. Drains get pulled out. There's so many things that can just go wrong, and you want this stuff to work.
Yes,
you do. You want success with your operation.
Yes, and we want you to move, for sure. Don't get me wrong. There's great benefit to staying moving in terms of preventing blood clots and things like that in your legs. But that means getting up every couple of hours, taking a lap inside your house, not around your house like I had a patient do. She's like, you said to go walk around the house. I meant inside, not around the perimeter of your condominium unit. You said around the house. Yes, I do want you to get up every few hours, do a few laps, keep the circulation moving. But other than that, you do not need to be walking around the block.
Yep, I agree.
And these are my preferences. There are other plastic surgeons out there that may have different ideas.
Totally.
You ask the 100 plastic surgeons in a room how they manage patients, you would have 100 different ideas. These are just what I think is important. So please listen to your surgeon and see what they think is important.
What about getting back to exercise, like light exercise, maybe some squats or, something like that?
I'm a 6-week girl. We'll say 6 weeks a lot. 6 weeks is a very magic number for every part of the body. It's a wound healing concept. At 6 weeks, those incisions are about as strong as they're going to be. They won't really get much stronger than they are at 6 weeks. So after 6 weeks, you can resume pretty much whatever you want to do within reason. Up until then, I want people to take it really easy. If there is some light activity that they can do, you can, start to go outside and walk, for 20, 30 minutes after the first couple of weeks. Maybe some stretching exercises, but why push it? You can wait another few weeks. I know some people let them go at 3 or 4 weeks, but why? Why risk messing something up when you can just wait till 6 weeks?
Yeah, a lot of people, though, work out for their anxiety and their stress levels. And
True.
So typically at 3 weeks, what I will do, if everything's going swimmingly and it's not there's no problems, it's not like a big redo, something or other, I'll let them do some 3-pound curls just to
Sure.
flex your biceps, things like that. I'll let them do some squats. I'll let them ride a recumbent bike, not get on the Peloton and go for the record against one of the trainers that they've been meaning to beat. It's not the day to do that. I want you to take it easy, but you can move. By 6 weeks, you should be able to get back to a lot of exercise, and by 3 months, then you should be full bore.
Full bore, whatever you want to do.
Yeah, on almost every operation we do.
Yeah.
But that's a way to think about it is at 3 weeks, you can start to move a little bit. 6 weeks, you should be able to do some exercise. I always say if it hurts, pulls, you feels wrong, don't do it.
Yeah, back off,
Yep.
try again later.
Exactly. And then by 3 months, you're usually good to go.
You should be able to
And
do
I
whatever
think
you
that's the truth for rhinoplasty, facelifts, for liposuction even. Liposuction's a little different because you can have some achy stuff after
long
lipo
time.
for a while.
But it doesn't mean that anything bad is
No,
is
it just
happening.
hurts.
It just hurts.
It's one of our nurses just got lipo and they were like, that liposuction was for real.
Yeah, that is not a small thing by any means. And I think just to round out the breasts, you're going to be in a post-operative bra, again, 6 weeks, magic number. And the post-operative bra has some kind of compression to it, like a sports bra. It buttons or zips up the front, because what you don't want to be doing in the first couple days is lifting your arms over your head and trying to pull things over your freshly, cut up breasts. And then it usually doesn't have any kind of underwire, because if there are incisions under the breast, you don't want a wire pushing up against it. That's the basics of a post-operative bra. And I say wear it for 6 weeks around the clock, night and day. Yes, I know, so horrible. But you need that. You need that constant 24/7 support for the breast. They can't just be hanging out in space. I have some patients that get the implants and are like, I don't ever have to wear a bra. I was like, okay, now, we're going to do a whole other podcast about bras, but for the first 6 weeks, just wear your post-op bra, please.
That is a reason that some ladies want to get implants, and they say that to me. I want to get implants so I never have to wear a bra. And I'm like, ooh, that's not how that works.
Not how that works. I mean, no.
Yeah. So about that, I'm like, you do have to wear a bra.
You do. Now, there are some outfits and some evenings or
Sure.
days when you can go without a bra.
Totally.
Maybe more than you would have been able to without the implant. You can, and it looks great. But as a routine, around the clock, everyday thing, no. Wear a bra.
No, you gotta care for the implants. I mean, it's a medical device. It's got weight to it. Especially those of you with saline implants. These implants water hammer. So every time you're taking a step, the fluid is pushing down onto the inframammary fold.
Yeah.
And that's why they tend to travel south and laterally more so than silicone implants. No offense to the saline implant people out there, but it's the truth. I mean, the silicone doesn't do that. So you do have to wear a bra.
But gravity always wins. That force is always there. So why wouldn't you want to counteract the force of gravity with an external bra? It just makes sense to me.
100%.
Moving on. Let's see. We kind of started in the middle of the body. Let's go back up to the face. Let's talk about the face.
So
recovery.
Things on the face, facelifts, rhinoplasty, brow lifts, blepharoplasty. In general, I think the main thing is you're going to want to prevent as much swelling as you can, because there's going to be swelling and bruising. So using ice, elevating the head on 3 pillows. I don't know where it says on the internet that you have to sleep in a chair, but everybody's like, oh, I've been sleeping straight up and down. I was like, it doesn't say that in the post-op. I said, oh, no, but the internet said that.
Yeah, okay.
I said, why don't you go by the instructions that I gave you? Because I did the surgery, and I know the internet didn't do this operation for you. So don't go by the internet. The internet has a lot of misinformation.
I had a patient today after a facelift. She had a little suture under her skin that she could feel, which is very normal in thin-skinned individuals, because we do put sutures under the skin. She's like, I can feel this little thing here. I'm like, oh, yeah, that's a little suture. It'll dissolve and go away. She's like, oh, yeah, I Googled it. And the internet said that it's probably a suture that the doctor accidentally left behind and should have removed. I did not accidentally. I intentionally left it behind.
I sutured your SMAS in position so that you look nice.
And I wanted to be there for quite some time. So
Yeah, it needs to heal that way. So, that stitch is
to suture the doctor accidentally left behind, and ask them about it. Please stay off the Google. If you have a question, refer back to your paperwork or call your doctor's office. Just please don't Google it.
Oh, my God.
Because
it's just
paranoia that it can create.
It's so bizarre.
Yeah.
It's so crazy that, who would write that? Oh, it's probably something that they left accidentally.
Yeah. Thanks for giving us the benefit of the doubt.
I lost. Where did that suture go? I can't find it.
Oh, wait.
We're looking right at it, people. Hello.
Yeah. So, anyways, yes. To go back to what you're saying, don't Google.
Oh, my God.
Listen to your doctor. Sleep. You want to correct the swelling, as we're talking about. So reclining is helpful for a couple days to a week. After a week, I don't know that you need to do much of that. And if you can't sleep in a super reclined position, I can't sleep on multiple pillows. Do your best. Don't lose sleep over this, literally. If you're a little more swollen the next day, not the worst thing in the world.
It'll go down.
So find a way that you can sleep as elevated at your head as you can. But if you're going to lose sleep and you're going to be uncomfortable all night, that's not helpful either.
You can buy those wedge pillows if you want to put one in there, and just keeps you at 45 degrees. I You don't have to sleep bolt straight up.
You don't. You don't.
I don't. My patients all do that. They're like, "Oh, I've been sleeping in a chair." I was like, "Why?"
Yeah.
Oh, well, it said that on the internet.
Nope. You don't have to do that. So you just got to sleep in a way that's somewhat helpful. You're going to have...
drain.
It does drain.
It does. If you're up, it will help you to get the swelling out. Ice helps you get the swelling out. Hyperbaric oxygen helps you get the swelling out of facelifts, rhinoplasty, brow lifts, blepharoplasty.
Go back to the Hyperbaric podcast.
Yeah, hyperbaric oxygen is really key. I like that a lot. We did a whole podcast episode about hyperbaric and its benefits and why or why not to do it. If you're claustrophobic, then that's going to be a hard one, depending on the place you go.
Take your meds.
Yeah.
We have meds for that too.
We've given you lots of medications that can help you get through that. But the main thing I really think people have to do is they have to be prepared, and you have to turn yourself over to the process of the post-operative period, that this is the time you're going to focus on healing.
Yeah. Absolutely. And be prepared. So for the faces, that means having that pillow that you talked about. We will give you all the head wraps you need. Everyone's like, "Oh, I'm doing a special head wrap." No. We're going to wrap you right after surgery. We'll give you a head wrap to wear afterwards. So we'll take care of all of that for you. We will give you all the prescriptions you need. You may need certain eye drops, things like that. Pick them up ahead of time so you have them ready and waiting. You're not going to want to eat a lot of really heavy food, so make sure that you have, soft foods around, smoothies, yogurts, juices, things like that. And for the faces, that's kind of really all. You really don't have to
There's not too much there.
There's really not too much for the faces.
We get a lot of questions about, like, should I do this? Should I do that? Should I wash something? No.
The faces are pretty much straightforward.
Let it heal.
There's really no dressing changes you have to do. There's nothing that you really have to do for a face than just let time
let it heal,
do its thing, and let it heal and chill out.
Yeah, and just be and call if you have questions. We're available.
Yeah.
This was the other thing with that other patient. She was just like, I didn't know this, I didn't know that, I didn't know. I was like, oh, did you call? She was like, well, no, nobody called me. I'm like, well, we have a phone though. Like, we have a phone number. We have text. We've got all kinds of ways for you to contact us. It's like we didn't send you out to sea, give you a paddle and say good luck. We'll see you on the other side of the Atlantic Ocean. We are very much available to answer your questions to every plastic surgery office. I think.
I would imagine.
Don't know. I would hope so. I mean, we're available. We want you to have the information because we want you to heal well, because we want your result to be spectacular, so that you love your result and you send your friends and come in for more stuff and you love coming to us. And that's part of it is knowing what to do.
We're all on the same team here. We're all trying
100%.
to get you to the best goal possible. Noses, we're going to hold off on because that's a whole different podcast. So we did faces.
The things we talked about for the face are pretty much the same.
Much it. But again, there's a whole
your nostrils will be asymmetric.
Dedicated
period.
podcast.
End of story.
Yes.
You can look at your nostrils all you want. They'll never be the same. I just want to throw that in there. There's a whole nostril asymmetry podcast that I tell every I have asymmetric nostrils patient to listen to, and then they don't ever talk about it again because they're like, oh. So they're not going to be the same. No, they're not. They never are. Never were, never will be. There's nobody else with with symmetric nostrils on Earth. So you're going to have asymmetric nostrils. And we'll make them as great as we can. They've got all sorts of tricks for that. Please go listen to those podcasts if that's your question.
Yes, agreed.
What about abdominoplasty? Which, by the way, I just want to go on record that I did one yesterday.
Oh, look at you.
I did. Mommy Makeover. Which I don't do many of them. I understand, I'm face and nose guy. Everybody, you do your complex breasts.
You do great tummy tucks.
I do. I do very nice tummy tucks, and I'm proud of my tummy tucks. Just because I do 1 or 2 a month, fine. So get over it. Chopra comes into the operating room and he goes, hey, what are you doing? I was like, what? He's like, you doing a mommy makeover here? Like, who are you?
That's not a nose.
It's like, I don't even know you anymore. I was like, this is one of my all-star patients' cousins, and she wants a mommy makeover, and I'm doing a great job. He's like, okay. It was hilarious. And it's like, I guess people just don't expect me to do a mommy makeover, but I can do a mean mommy makeover.
I know. You definitely can.
Thank you. And I appreciate that. I appreciate your support. And my patients really like my tummy tucks.
I know.
It's always somebody I know. I do admit that, though. It's always like somebody I've operated on or their family or something like that.
And you do a great job.
There's nobody Googling me for tummy tuck or mommy makeover, which is okay.
That's okay.
You're killing it on mommy makeover on the internet, though. Don't they find you a lot from Google and all that?
I mean, I do a fair amount of these. So
You do.
I do a fair amount.
Literally tons of them.
Literally, if we were to add
Literally.
how much weight I take off, it's probably tons. So I know a little bit about postoperative care and tummy tucks, just a little. So again, if I tell you to do something, it's for a good reason. This is one where actually, if we just said the faces don't really need a whole lot, the tummies need a lot.
They need
this
a
is
ton.
where you really need to actually dial in, read your postoperative instructions ahead of time, because you do need to have some things available ahead of time, and there are going to be some more restrictions. So that first week after surgery, you do have to sleep or sit in what's called a beach chair position. That means that the head's up a little bit, the hips and the knees are bent. Like imagine like you're at at the beach, sitting on the beach. And there are all kinds of devices out there to help you do that. Some people rent recliners. You don't need to do that. You can just prop yourself up with some
Two pillows under the knees.
some behind your
Couple
back.
behind your back.
And that's fine. The idea is that you don't want to be completely flat because you don't want to put stress on that lower abdominal incision.
Not for 2 or 3 weeks.
Not for a little while.
Yeah.
And the same thing goes for when you're walking. You're going to walk a little hunched, a little bent over. You don't want to stand up completely straight. Again, you don't want to put a lot of tension on that incision line. Some people find it helpful to use a walker during that phase because walking bent over without a walker can cause some lower back strain. So not everyone uses it. Small percentage of people find it helpful. But these are just things to kind of think about going into your postoperative time period. Do you have a place that you can recover in your house, whether it's that recliner, a bed, some pillows? If you have a high bed, do you need to get some steps to go up to it? Do you have a couch you can use? So these are things you do need to plan ahead of time.
And steps. If you can stay on the first floor, I think that's really helpful.
Please.
I don't think steps are awesome in the post-abdominoplasty.
I don't
patient.
either. And if you have to get up to steps to your apartment or to something else, that's fine. But if you're in a home and you can kind of prop yourself up on the lower floors, that would, I agree, be ideal.
I don't love stairs. I don't want you lifting anything.
Absolutely not. Like, this is where you really have to dial back your activity. For that first week, you have to respect those positioning constraints. I put drains in my patients. I know some people don't. Same thing with the drains. I want to get them out. And if you start doing a lot of activity, it's harder for me to do that. So plan for the first 3 weeks to, again, be a pretty princess on the couch. You don't need to be doing any kind of housework, laundry, grocery shopping, dinners, lunches, nothing. Just keep your butt at home, get up, walk around a couple times every 2 hours or so, and then sit back down again. That's all you need to do activity-wise.
Yeah, I mean, you just want to really prepare for this post-operative course. And I spend a lot of time with my patients saying, this is how this works. Mommy makeovers are big operations. They sound so cute.
They sound so cute.
Oh my God, so cute.
It's going to get a little makeover.
I'm going to get a mommy
today.
makeover. It's so cute. It's not. It's
not.
a massive operation.
But it's also like a huge
It
hit.
is. It's
on
a
your
big hit. And it's your core.
Mm-hmm.
It's like it's a breast operation of some kind. It's an abdominoplasty with or without liposuction.
If you've added liposuction, take the typical recovery sensations and feelings and multiply it by multiple factors.
Yeah, it is.
Because
It's a
that
big deal.
liposuction hurts and it definitely adds to your discomfort. It's all manageable. Patients will have some pain and discomfort. We give you the pain meds. We give you the muscle relaxants. Usually by a week, people are feeling okay. They're coming off the medications. They're doing okay. They're standing up straight. They're getting a little bit more mobile. But again, I like the full 6 weeks for any kind of heavy lifting, strenuous activity. Once those drains are out, which for me is 1, 2 weeks, sometimes 3, then you can start to do a little more activity around the house. But until then, you stay quiet. There's not really a whole lot you have to do for dressing changes for all of these procedures, breast, body. I do all the dressing changes when you come see me in the office. You see me a fair amount, so at every time you see me, I'll change your dressings. I will show you how to shower if you have drains in place. I like shower chairs or a way that you can sit down in the shower just for the first couple weeks, just because I don't really want you standing. I've had patients pass out in showers right after surgery. So if you can sit, you can get a shower chair, just a chair that can go in a shower is really helpful in the beginning.
Yeah, it is. It's great. And the drains are, we do progressive tension sutures. You do them, I do them, and that does reduce the time to getting those drains out. I usually wind up getting them out in a week, maybe 10 days at the longest.
Yeah.
But I put one in, my patient yesterday, and there was, a good 180 cc's of tumescent fluid that came out of it because I did lipo on the sides. So I don't know if you do a painless, drainless tummy tuck where you don't put a drain, where does that tumescent fluid go?
I don't know.
It's Seroma City.
We're not talking about that
All
today
right, I'm just saying.
I don't know. I don't have an answer for you.
All right, I know you don't.
Not today. What else about the tummy tucks? Positioning, dressings, drains, take your medications. I love lymphatic massages if you've had liposuction. If you were like a skinny mini and all you had was some skin that needed to be removed and muscles that needed to be tightened, you don't really need the lymphatic massage. But if you've had any additional liposuction done at the time of your tummy tuck, lymphatic massage is super helpful. I realize this is kind of regional. To us, it's just like as normal a habit as doing anything else in this city. And I think some other places don't have it. But these are specialized massage therapists that are trained to get the postoperative fluid out of the body a lot faster. And I find them patients that do it have a smoother, tighter result much faster.
100%.
And they feel better. Yeah.
Yeah, no, it's I love lymphatic massage.
Oh, it's so good.
I have great lymphatic massage therapists, both in Beverly Hills and Newport Beach, and they make a big difference for the result.
Yeah.
I think it's really, really nice.
And you can start as early as a week afterwards.
Depends how painful it is.
Yes, but they can go light. And I think sooner is actually better if you can tolerate it.
Yep.
So take your pain medicine, go get a light massage. They know what they're doing. They do this all the time. So they'll know how fresh post-op you are and what they can and can't do with you. But again, that's something you have to look at ahead of time. Get that booked so you have it ready and waiting for you when the time is right after surgery.
100%.
Garments, I don't really make people buy garments ahead of time. I will provide you with the garments that you need right after surgery. As you're coming closer to a week postoperatively, as your swelling's coming down, the drainage is coming down, we can talk about purchasing some different garments, and I'll show you what you need. You will wear that for at least 6 weeks to 3 months after surgery, so plan on purchasing a couple of postoperative garments. You don't really need to purchase them ahead of time, though.
Yeah, I mean, it depends how much lipo's involved, et cetera. Yeah. I mean, especially if you're doing like thighs and tummy and flanks and then you really have to get specialized garments.
You have to get special garments.
And we have all that. It's doable.
Yeah, we can walk you through what you'll need.
My lymphatic people in Newport are usually very good about that too. They have like tons of garments that they think like, this is better, try this faja, do this, do that. And I think they're right. They're really helpful, and you do need something.
Right. For our non-Spanish literate people, a faja is a compression garment. We forget.
It's true.
That's not what everyone calls them.
I know. This is Southern California.
Yeah. And it's very common to use the fajas and to do the lymphatic massages in our neighbor countries south of the border. It's very, very common for all their body contouring procedures. And I think we've just accommodated and started to do a lot of that here in Southern California as well. And it's super helpful. I'm glad we're doing it.
What about post-op, just lipo procedures? Anything that you would add to that? Because that kind of piggybacks onto what we're talking about, abdominoplasties. I think they're pretty similar.
They're very similar.
Yeah, so just kind of put those into your post-op lipo sort of protocols.
Yeah.
Anything else on these?
And people always ask, what should I eat? Common sense. Like, use your common sense on what you should eat. Your body's pretty good at telling you what it needs and what it wants. It's the rare patient that wakes up going, I want a hamburger. Usually they're like, I want a smoothie. I want something. Their body kind of tells them what they're feeling up for. Keep in mind that no matter what surgery you've had, no matter how good your GI tract is, if you have had anesthesia, it will slow down your bowels, and it may be a couple days before you have a bowel movement. So whatever you put in there needs to be soft, easily digestible. It's not the time to go ham on like a big steak or burrito or something like that. Like just gentle foods.
Does everybody know what ham stands for?
No.
Oh, okay. Google it, people. Urban Dictionary. That is definitely something we say in Southern California.
I know.
Very frequently. So would you say it's not a good time to go ham on a ham sandwich?
Not the time.
Not the time.
No.
I always tell people don't eat a lot before surgery,
True.
especially before tummy tucks.
Oh, gosh,
I was like, why don't you do clear liquids the day before?
Yeah, you don't need to be all bloated right before we tighten your tummy up.
Come on, don't pack it in there.
No.
And especially that makes it harder on me. I want to be able to close that stuff up a lot, nice and tight. And if there's a bunch of like stuff sitting in there,
not helpful.
Not helpful. I'm trying to get a scaphoid abdomen by the time, and that's basically an inverted, scooped out abdomen. I want it sucked in and looking awesome.
Yeah. So no, none of that.
As it did yesterday.
And you don't need to take protein supplements and peptides. Like, just common sense. Do you eat protein and vegetables and drink water on a regular basis? Great. You're good to go.
It's true.
You don't need
change things for surgery.
You don't need to power on the protein shakes and bars, just your regular stuff.
And of course, the stuff that you stopped pre-op that makes you bleed, you should wait a couple of weeks before you restart it. So like all the St. John's wort, the vitamin E oil, the fish oil, the aspirins, all those things that you stopped to not have bleeding after surgery, wait at least 2 weeks before you start back. And best to ask your surgeon when to restart those things.
And I feel like I shouldn't even have to say this.
Oh, but you do.
But I will, and then we will finish. Please don't smoke.
Ugh.
And guess what? Vaping is smoking. I don't know why I have to distinguish the two of them, but I do. Vaping is smoking. So do not smoke. Do not vape. Yes, you can have your special gummy bears. But other than that, I thought, can I have my gummy edibles? Sure, fine. Do whatever you want.
Go for it.
Go for it. But just please don't smoke. That will impair your wound healing. We know this.
Don't vape.
Just don't do it.
Don't tobacco product. Don't nicotine.
Yes, all of that clamps your vessels down. You impair the blood flow to this area that needs massive amounts of blood flow to heal. It's just a huge detriment to your healing process. Just don't do it.
Yeah, we're not here to be party poopers. We're trying to get you to heal.
Yeah, I don't care if you smoke. Just not right after surgery, please.
I care if you smoke. It's kind of gross.
Well, yeah,
I just don't love it.
To each his own.
I don't like it. No.
Okay.
It's just my thing. You can smoke, but just not near me.
Just not. And not right after surgery.
And definitely not after surgery, please. And vaping is pretty much the same deal.
Smoking.
It is.
It still has the nicotine in it.
It is. Same deal. Well, I think that's it. Any other little pearls that we wanted to throw out there?
I think that's it.
All right. Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.